Good evening, Miss. I would like to explain about the degree of hypovolemic shock, but before proceed to that, we need to know about the hypovolemic shock. So, the hypovolemic shock actually it starts from here. We need to know our mean arterial pressure equals to cardiac output and also our total peripheral resistance. So, our cardiac output is produced through the stroke volume and also heart rate. So the stroke volume is preload and contractility. So we need to have adequate preload and also adequate contractility of our cardiac muscles in order to produce adequate stroke volume, and it can produce adequate cardiac output. So if there is reduce in our preload, so we will have hypovolemic shock. So hypovolemic shock in this case is due to low preload due to the bleeding of the upper GI tract, and it will eventually reduce our stroke volume. And also because the patient has underlying coronary artery disease, so he will has reduced contractility of his cardiac muscles due to the stress in the body that he experienced, and it will further reduce the cardiac output and reduce the mean arterial pressure and increase the total peripheral resistance to maintain his blood pressure by vasoconstriction. So now we'll proceed to different degree of hypovolemic shock. So normally hypovolemic shock is due to hemorrhage, and in this case also hemorrhage. So there are 4 classes: class 1, class 2, class 3 and class 4. So class 1, it is defined by the blood loss more than 750 ml in the circulation, and total blood loss is more than 15%. And the pulse rate is less than 100, it is still normal, and blood pressure it is still normal, and capillary refill time is normal, and the respiratory rate is still normal. But in class 2, the patient may have blood loss for 750 ml to 1,500 ml in the circulation, and blood loss 15 to 30%. The pulse rate may exceed 100. The blood pressure may be normal due to the compensatory mechanism, and the capillary refill time may be delayed, and the respiratory rate may increase. For class 3, the blood loss total would be 1.5 liter to 2 liter, and it is about 30 to 40% of our blood loss from the total circulation, and the pulse rate may exceed 120 beats per minute, and the capillary refill time may be delayed, and the altered mental status may occur. For class 4, it is the most severe state of the hypovolemic shock. So in class 4, the blood loss total would be more than 2,000 milliliter, which is 2 liter, and the blood loss more than 40% of the total circulation, and the pulse rate will be exceeding 140. Blood pressure, pulse pressure will be low, and the capillary refill time will be delayed, and the respiratory rate will be much more higher, and the patient may have altered mental status.